I, like all of you, work very hard. I, like most of you and all physicians, we're busy with our everyday lives. We dedicate our lives to our patients. We give a lot of energy. At the end of the day, we come home and we devote time to our families. We try to keep up with medicine as far as our continuing medical education credits. And then we find out that the government wants us to do more than that. They want us to give more than we have. I've spoken to my patients and I say, no matter what profession you're in, would you like to go back to high school and take your exams over again? And they all say no, of course. But in our everyday lives, we work hard, we don't pay attention to what's going on. And I'll start with one quote from Edmund Burke, who said in the 19th century, the only thing for evil to triumph is for good men not to do something, not to speak up. And we need to speak up. We're at the crossroads of this country, and it's bigger than just physicians. So I'm busy seeing patients. So I get a phone call from Bill Ficazio, who is an individual I admire and respect immensely. He's an individual that did a fellowship in infectious diseases under the great Leon Smith. And so when he calls, I pick up the phone and he says, listen, and before I get into that, I got an interesting email about this invitation here. And it says, Dr. Tedeschi and the Jersey Boys. I said, Jersey Boys, that's a cute thing. All right, Jersey Boys. Well, it's very ironic since we are right by Clara Maass Hospital, where the Jersey Boys all started in the area. Behind the hospital is a street called Tommy DeVito Way. And so I thought that was kind of interesting. So he calls me and he says, listen, you got to call to this guy. I go, what guy? He goes, oh, it split his mind. He says, you know, the guy from South Jersey. So he gets me his number. I call him up, and John Tedeschi starts telling me all these things. Now, I'm a practitioner like all of you. I'm supposed to have my hand on the pulse of what's going on with medicine. I'm president of a medical staff at Clara Maass Hospital, which is part of Barnabas Healthcare System, which is the largest healthcare delivery system in the state. I go to board of trustee meetings, I go to med exec meetings, and I have no idea what he's talking about. Maintenance of certification, maintenance of licensure, tying your fee schedule to your exams. Insanity. They give no credit for experience. And I want to tell you something about a little bit about Jersey. 22 years ago, this past January, New Jersey passed a law that I think began to whittle away at our practice of medicine. They told us that we, as physicians, couldn't distribute medications in our office. You know, as I said, I was in medicine, that's why I brought that up, is that we were open until 9 o'clock at night sometimes. And back then, there were no 24-hour pharmacies. So physicians came across a company that would bottle medicine for you with your name on it and the directions as you wanted. You would put the patient's name on it, peel it off, and put it in a booklet to keep track of it. Well, the pharmacists got together and they decided to lobby a law that said we can't do that. And so the law in New Jersey right now says you can sell medicines to your patients if you want, but only for 7 days, and you can't mark it up more than 10%. That effectively destroyed any effort we had to help our patients. Fast forward 20 years, I'm driving by the CVS in Cedar Grove, and it says Minute Clinic. And I said, what the heck is that? And I said, Minute Clinic, and I find out that what they have in the pharmacy is a nurse practitioner or physician assistant that sees patients, and they don't give you a prescription, right? They electronically send it to their pharmacy inside the CVS, and you go over there and you pick up your prescription. I had a lady that was in there, healthy individual, no medications, she had a cold, maybe a little bit of a sinus infection. She went to the Minute Clinic on a Sunday, and they're trying to be nice and send me a report on the lady. Well, the lady got 5 medications. Perfectly healthy lady, 5 medications. Not 1, not 2, not 3, not 4, 5. She got an antibiotic, she got a decongestant, she got a cough medicine, she got an inhaler, and I don't know, whatever the hell else she got. 5 medications. We can't distribute medicines in our office, but they can have a nursing assistant, nurse physician, seeing patients under the guy, and that's good patient care? I'm not sure. So I contacted the state senator about this. Why'd you guys pass a law 20 years ago? You can't have it both ways. And they said, well, you know, we don't know. We'll send it off to Consumer Affairs. And Consumer Affairs looked at it and said, they're not doing anything wrong. I said, oh, really? So I decided to combat that in a way that's kind of maybe a little novel. I called my staff and said, listen, get medications from Henry Schein, the supplier. And so I buy antibiotics, and I give them to my patients that don't have insurance. Levaquin, $6 for 10 pills. Go to Walgreens, $169.99 for generic Levaquin. CVS, $147. And they talk about physicians doing things that are inappropriate or whatever the adjectives may be. It's unbelievable what's happening to us. And we as physicians stand by and let this happen. I got to give it to the mom and pop shops of pharmacies. They were between $20 and $30, including ShopRite. And Gianno's right here in Newark, $10. So my opinion is to tell your patients to go to the mom and pop shops, because what the big chain pharmacies are, they're trying to have their cake and eat it too, and blame physicians for all the costs and expenses of medicine. Another quote is from Martin Luther King, and Martin Luther King said, "We begin to die the day we don't speak up on things that matter." Well, this does matter. We need to speak up. We're the most educated people in the country as a whole. We need to voice our opinions. We need to speak up. And this country is really heading in the wrong direction. Where are we in this country? We as physicians need to not only speak up for ourselves, but to speak up for the country. And what's happening right now, as medicine's example, is going the wrong way. And we need as a whole to organize, to get together, and try and combat what's happening to us. Because it's not only us, it's our whole country. And I thank you all for coming. I will also say a Thomas Jefferson quote. Thomas Jefferson said, "A government that can give you anything will be strong enough to take everything away from you." And that's what's happening to us. And we need to really, as physicians, leaders of the community, we need to get together and speak up and do something for our country, not only ourselves, but our country. If I could find the paper on Dr. Tedeschi, we've been speaking to him for many, many conversations. Dr. Tedeschi is a physician trained in family practice. He has a fellowship trained in geriatrics and gerontology. His office is One Medical Plaza in Robbinsville, New Jersey. He's the medical director of Holy Redeemer Mercy County Hospice. His experience encompasses extensive background in government, state, and academia. He's the founder of PCE, its Physician Center for Excellence. He established this organization for the support of medicine and patient rights. He's a supporter for all movements, organizations collaboratively for One National Organizations for Health and Well-Being of American Patients. He is ardently involved in the plight to take back medicine, and take back not only our medicine, but our country. And he is actively involved in reaching out to physicians, and as I said, he from Bill Ficazio, he's reached out to me. And I have to tell you, we put this together on a shoestring and a prayer. I'm happy that you all came here. Please pass the word around. This is being broadcast on Skype all over the country and around the world. Tell people about this. We need to take a stand. We need to stand up, because what we do does matter. And as one voice of physicians together, we can make a difference. I'm a person that's an optimist. The glass is half full, not half empty. Somebody told me that we should have done this 20 years ago. Listen, we have to try. Don't give up with that attitude that we can't make a difference. If we did that, if our founding fathers did that, in 1776 we wouldn't have a country. We'd still be under British rule. So please, speak up, stand up, do something for America, not only physicians and patient care, but for the United States of America. And so I'll hand this over to Dr. Tedeschi. He's the man, he's the brain behind all this. And the sculpture that you saw, that was up, he's a sculptor. He's a very talented individual. He made that sculpture of Hippocrates, right? Dr. Tedeschi, come on up. Before I do that, I said my father was a legislator. His grandson, my son, is trying to follow in his footsteps. He's here. He's running for freeholder at large in Essex County, not at large, District 5, which is Belleville, Nutley, Montclair, Bloomfield, Glen Ridge. So if any of you people live in that community, sign this petition, tell people to vote. he's got the same kind of ideals that I have, which is to help people. So I just thought I'd mention that. God bless.
Well, I can't memorize all that, so I have to use my papers. Again, this is amazing how all of us are here today, from talking to Billy Ficazio, Dr. Ficazio. I know him as Billy. We were medical students together. And how quickly everything from a small seed evolved into this, with people from all over getting involved in really bringing compassion back into medicine, because that's why we became physicians. I must say I'm very thankful for Dr. Kelly, his most powerful support to get this event together. I don't know whether it was an act of God, but I'd have to say it. It was an act of energy that, well, I shouldn't say energy, I'll just say it was an act of God or fate or whatever. I'm also honored and proud and grateful to have speakers from all over the country, speakers that are going to be Skyped in, speakers that have come from other states. And this is the first time that all our nationwide supportive physician organizations have come together under one roof in New Jersey. Good afternoon, ladies and gentlemen, and my fellow physician colleagues. I'm sorry, Dick, that fell off. I'm very happy to see all of you here today, and for the first time in history, we physicians are celebrating National Doctors Day for physicians by physicians. I'm happy here, but I must say I'm very concerned because of the necessity of us having to talk about such things, such changes, such as the present events that are squeezing the very life from the way we physicians practice our art of medicine. So fasten your seatbelts, because you're going to hear a lot of different things that you may not be aware of or you may be aware of, but things that are going to affect your lives. Every day we witness our freedom to care for our patients taken away. And at this time we are being eliminated from serving a most needed American society. Medicine is now at the crossroads, where erosion has reached the point where the relationship we have learned, developed, and cherished as physicians is disappearing, only to be left as a fragmented historical footnote unless we physicians act now. I can't overemphasize this point. As you note in your handouts, the professionals that are putting on this presentation hold the Hippocratic Oath in the highest esteem. And I ask you to remember that day that each of you took that oath, before licensing, before specializing. That day you crossed a boundary that cannot be retraced. It's like a bird in the sky. When the bird flies in the sky, you can't trace where it's been. It dissolves. This is something each one of you have crossed. And I ask you, please, to keep this in your hearts and minds as you listen today. The question of the day is simple, addressed to every American, including ourselves. Whom do you want to make decisions about your health care? The government? Insurance companies? Your doctor? Regardless of the answer, without physician and patient autonomy, there shall be no freedom for the American people. Today I have come here for one reason: the calling together of physicians and patients to save our noble profession, a long-awaited and most needed quest. There are many of you that have been involved with this for years. You've struggled for years. You knew this was going to happen. And you're here today seeing this already predicted. For those that don't know me, I am a simple doctor. I'm no longer in competition with my fellow colleagues. I was involved with so many different organizations and so many different groups. I was brought together by organizations that made me certified and then say I'm not certified. Now confronted as you are with this bait and switch tactic, this tactic by the American Board of Medical Specialties, I must maintain currency with a past tense certification. I wonder if and when our medical degree will expire. Can any other profession, such as law, judges, Supreme Court judges, presidents, dentists, lose their degree or their certification, or even require redundant written examinations that these corporations are calling for? And in your handouts, you'll see the American Board of Medical Specialties and internal medicine articles that we presented for you. Even worse, thinking about the thousands of physicians that are out there that are not even in this room and don't even know about this, that are a belief that they are grandfathered in to a permanent certification. I got news for you, you're not. And let's not forget the many well-respected, great physicians, teachers that started this country with medicine, who have attained their degree and license. They follow their they follow their CME. They chose not to voluntarily certify, and that was originally what it was all about. They have dedicated their lives, a calling, saved hundreds of lives, continue to give quality care, they're compassionate to their patients, and they're also subjected to these outrageous rules and regulations of certification. Tell me, anyone in this room, any one of you, do you feel that they're not qualified doctors? Can any one of you say they're not qualified because they didn't get board certified? Today I'm hoping for a day of realization. With the speakers here today, we hope to remove your confusion, set forth a movement against greedy insurance companies, shareholders, American Board of Medical Specialties, the Osteopathic Association of Medical Specialists, government mandates, hospital mandates, and all other money-making propagandists that pit patients against their doctors. And let's not forget this divide and conquer that they worked on with us. It's time now for internists, family doctors, specialists, surgeons, DOs, MDs to come together. And there's no time to lose. Think about your original intent to become physicians, your devotion to become physicians. How do you know if you're practicing your vows today? Well, if you want to see your patients, your family, and yourselves treated as human beings with respect and dignity, you are in fact practicing your vows. You will also be practicing your vow if you continue to practice this cherished and beloved profession for the benefit of all mankind. If you opt not to give up your extensive years of tedious training. If you want your patients and beloved family protected from unethical medical behavior, and if you don't want physician extenders governing you, such as nurse practitioners getting a PhD in nursing, soon to be called doctors, and directing you physicians on how to practice your art of medicine, and one day oversee your department, treat you, your patients, your family, and even your children. Many of you may say, well, I'm retiring. I'm out of here now. I don't even have to worry about this. You have children. You have the respect of your profession. If you want to still see this most noble profession to remain the best in the world, and if you don't want to see socialism entrap a society again by taking control of doctors and controlling the people, you are practicing your vow. And if you don't think this country's in jeopardy, and I'm sure when Dr. Jane Hughes speaks, she'll explain a little bit more to you about this. And if you don't quite understand what I'm saying, let me explain further. Think about it. 10% of those that signed the original Declaration of Independence were physicians. Today, physicians representation in Congress is 17 out of 535. That's 3.2%. Not one physician was present during the establishment of the Affordable Care Act. Tell me, how is it possible to have a health care instituted without input of physicians? We are witnessing a relentless greed and unethical behavior that is jeopardizing the health and welfare of the American people. A systematic elimination of the physician as an active role model, a role model who formulates a humanistic and compassionate approach to health care. Passively, we all sit here even to today, witnessing a complete dissolution of health care, predicted by many physicians that are in this audience 20 years ago. Rather, we should be demanding the presence of the physician as an integral part of a supportive heritage of this country. Again, the American Board of Medical Specialties, the American Osteopathic Board of Specialists, coming together with the government, mandating the AMA's new ICD-10 code system. There's a new one. International classification of diseases that change at their whim for the satisfaction of financial gain. Today we will expose for you the truth about the financial and regulatory capture of medicine. Physicians are aware of the many diagnoses that are learned in medical school no longer exist for payment under government and insurance guidelines. These are the ICD code numbers. How can this be? How can these coders, aka AMA, and now hired government law firms come into our office who have never seen our patients continually change our medical direction? How can we as doctors bill for treating an ailment, a disease that the AMA code book now says is questionable? This is dishonest. Every day we must quickly match their changing, inconsistent codes. This is nothing else but a money-making monopoly imposed on the entire medical community. We must expose this and break down this cruel and misleading financial and regulatory capture of medicine. And let's not forget the AMA reported $72 million in revenue from their royalties and credentialing products in 2010. Well, that's great for them. When the AMA gets 2 to 3 times more funding from the government than its own members, one's got to wonder, is the AMA a tool for the government or for the doctors and the patients? This is outrageous. It's purely unethical. It's not the American way. And it borders? It's fraud. This is from policymakers who scrutinize every one of our entries for accuracy before we even get reimbursed. Clearly, the AMA sold us out, and their illusion still continues to falsely represent us, not only as American people, but to our fellow colleagues. The truth is, only 16% of all USA doctors belong to the AMA club. This is approximately 100,000 of the total 800,000 physicians nationwide. And only 13% of the 100,000 AMA physician members supported Obamacare. This is only 13,000 doctors in the United States. Even though the AMA's majority members are 87,000, and they didn't approve Obamacare, the Affordable Care Act, the AMA still ignored the majority of their voters. I spoke for 45 minutes to Dr. Richard Hawkins from the AMA and received no support of our cause. No support. In fact, he stated the AMA is supporting continued lifelong written recertification. He was invited to speak today, but he declined. Now you can see how the AMA survives. Hopefully the people that listen to this will see how the AMA survives. With code books, all paid for by the federal government. Unfortunately, recently I've also come to realize that the president of the American Association of Family Physicians, Dr. Reed Blackwelder, who has personally emailed me, he is also in favor of maintenance of certification and maintenance of licensure. rising up against us to mandate written examinations. Few states, societies, such as the Medical Society of New Jersey, I am proud to say, the American Association of Physicians and Surgeons, patient-physician alliances, Docs for Patient Care, Independent Physician for Patient Independence, ChangeBoardRecertification.com, and American Doctors for Truth firmly are on our side regarding anti-MOC, that's maintenance certification, and MOL. And we need more support. We have support from all over the country in small little areas, but we need to have greater support. These are the reasons why we are here today. We who have taken the vow, we who have sustained the years of intense training, facing other issues, we see the government initiating the accountable care organizations, the new ACO model. This is a petri dish for the new theories of liability. Have these policymakers, shareholders, members of financial institutions, and government forgotten that they too are all patients and will soon become victims of their own corrupt, dysfunctional system? Congress don't have to deal with it, but they do. As physicians, we are continually told what to do, mostly by business administrators and financially driven organizations who are not physicians and have never practiced the art of medicine. What an injustice to the American people to put us in that situation. They direct us who can be part of, who should be eliminated from a hospital staff, who needs to be reviewed. As physicians, we're continually told what to prescribe, how to write it, how to document it. We are mandated to give away personal electronic health record information to the government, insurance companies, and pharmacies that is being used against us and our patients. How can the government demand us to comply with HIPAA when they and other organizations are free to sell and buy our private medical records? Just take a look at the recent story of Spirit Airlines obtaining personal health information and then firing employees based on diabetes and age. Tell me, whatever happened to patient care, patient-doctor-private relationship? So many issues, so many questions. How many of you have been audited because you spent too much time with your patients? How many of you had to pay back thousands of dollars to insurance companies that was rightfully yours because you spent too much time and you saved a patient's life? Unfortunately, you may have clicked the wrong part of your EMR or your EHR button. All these systems entangling the care given to our patients, drawing them further away from us so we can't figure out the correct diagnosis. This is clearly a system failure. The Milbank Quarterly Report asserts that it is the systematic sources that are carrying risks that significantly exceed professional incompetence as the dominant cause of harm to patients. It's a system problem. It's not a doctor problem or a professional problem. It's a system problem. Physicians are now coming to realize we are being made the scapegoats for this corrupt system problem. The fact is that we are being dosed by a multi-million-dollar medical education bureaucracy with physician sellouts at the top merely at insult to the injury. This malignant medical specialty societies fervently believe that dosing out more CME and now maintenance of certification, both unproven methodologies will stamp out physician inadequacies, despite the knowledge that the bulk of medical errors, as I just stated, are due to systematic events. Tell me, how long will it be before we're dictated to who will live and who will die? And let's remember, Congress is exempt from this Affordable Care Act. It's getting worse. The media is reporting that the Affordable Care Act is spending millions of dollars to expand the role of nurse practitioners. Citing documented information from the Jacksonville VA, the plan is to gradually eliminate medical doctors as solo practitioners and department heads and replace them with nurse practitioners. Nurse practitioners are already working independently in the Veterans Administration, providing our care for our nation's veterans. Our veterans have fought for our country, and they can't even see a physician when they come back home. Nurse-managed health care centers will simply become the norm and replace the most needed demand for physicians. It is the power of lobbying and political persuasion presented to the medically ignorant in some of our state governments that has allotted nurse practitioners to be held essentially equivalent to physicians. Did you know that the State Board of Medical Examiners has no jurisdiction over nurse practitioners? They're not physicians. This law must be changed. Under the Obama administration, the government has issued millions of dollars in grants to states to increase nursing programs to both nurse practitioners and midwives that will essentially eliminate medical education or the physician role in primary care. It's my understanding that the present administration media has said nurse practitioners can provide 80% of what we primary care physicians can do. We are slowly being sold out to the lowest bidder. Tell me, how many of your state legislators would be first in line at the nurse practitioner's office? Despite your years of training, experience, and talents, we are constantly criticized, arbitrarily tested, testing our doctor qualifications, and soon mandating maintenance of our certification. A certification that is being progressively tied to our license in the state in which we practice. You may now be forced to retire, or even worse, lose your license. Fact. We are seeing the continued extortion of physicians. The Affordable Care Act, MOC, MOL, OCC, joint venture, going into effect next year, will penalize all physicians treating Medicare and Medicaid 1.5%, and then again 2% deduction the following year, if physicians are not redundantly recertified as tyrannically ordered. This is clearly another financial, regulatory capture of medicine. These written certification, MOC, OCC, MOL examinations, and modules that you got to take, it's a disgrace. Example, the American Board of Internal Medicine reportedly makes $41 million a year just from physicians taking these redundant examinations. And now we are witnessing the government and insurance company regulations directing us into unethical practices for the sake of reducing the national debt, instead of having the interest in maintaining true quality care for the American people. We are the ones that are going to reduce the national debt at the expense of our patients. Regarding our legal pursuit, we'll hear from Andrew Schlafly. He has initiated a lawsuit that opposes maintenance of certification. He's a past editor of the Harvard Law Review and a classmate of Barack Obama. Andy is also challenging the constitutionality of Obamacare, and he's here today. Today, the government has aligned task forces into every branch of medicine, purely to control over the costs rather than concern for the quality of care for the American people. And it is this very government that is on the verge of financial collapse, a government that runs the Postal Service, the VA, Amtrak, FEMA, Fannie Mae, Freddie Mac, Medicare, just to name a few. And now it wants to take over health care. What upsets me the most is this constant daily badgering you get while you're in practice, the abuse of discrimination against us doctors, and further limits our freedom to care for our patients. How many of us have to battle to get a test done to save a life? Today, Dr. Jane Hughes, an ophthalmologist and president of the Texas chapter of Docs for Patient Care, will be speaking on where we are now with Obamacare. She has solutions on what we need to do as a united front. Jane is here today. I ask you, where is our voice in all this? Why aren't we speaking up? How many people came here? I expect thousands. This is ridiculous. I'm grateful we're all here, but my God, wouldn't you expect more individuals to be involved with this? Our voice on behalf of our patients, our profession, must be sung from the rooftops. We physicians have trusted. We work hard. All these medical guidelines and regulations and restrictions, we trusted. We thought they were going to help our patients. We were all deceived. Sacrificing human life should not be used to save a failing economy. This is cruel and unusual punishment, and this is not the American way. I ask you, who's too old in this room to be treated? Who's too young? Anyone in this room? Your mother? Your father? Your child? Check out the government website, U.S. Preventative Service Task Force. They recommend against breast self-examinations, because only 10% of palpable masses are cancerous. The other 90% are benign. Yet 10 to 15% of all breast cancer are not detected by mammo. And the standard of care in a court of law is that the palpable breast mass not seen by a mammo needs a thorough diagnostic workup. Take, for example, answering your MOC question. By you recommending a breast self-examination, you get the answer wrong. Clearly, this is an example of the regulatory and financial capture of medicine. They are directing us through examinations to treat people unethically. If the government needs to address the national debt, then it should not subjugate the American people to lower standards of humanistic and compassionate medical care. Nor should it dictate health care guidelines that are financially driven. Our neighbors in the north have found out the hard way. Canadians come across the border in droves because the health care system has failed them miserably. Again, we physicians are here today not for ourselves, but for our patients, our families, the American people. We need a strong organizational support that will allow our voice to be heard, a unified voice with organized strength that can cut through the bureaucracy, magnify and resonate our humanistic concerns, our vows. We need to spread the word so that we can freely treat 250 million Americans across this country. We must take advantage of the many opportunities that exist to allow our collective issues to be expressed and handled. To our patients, to ensure the strength and sanctity of the patient-doctor relationship. I believe that gaining political power will be the key to an effective change. We must bind together as physicians first and be true to the oath and our patients. Our only hope is to stand together. Finally, I am not sure how many of you remember this nor appreciate its significance, but allow me to close with this. This is the oath, the end of the oath. If I keep this vow, this oath faithfully, may I enjoy and practice my art, respected by all humanity and in all times. But if I swerve from it or violate it, may the reverse be my life. If we walk away from resolutely retiring or going off, facing these issues, we will leave for future generations of patients a legacy produced by what others have sown. We owe them the harvest, which we as medical professionals with humanistic values laid down centuries ago by our founding father, Hippocrates. We owe them what we have sown, so we can rightfully say that our time on this earth was not wasted. Thank you. I'm proud and honored to present Mr. Andrew Schlafly, who is General Counsel for the Association of the American Physicians and Surgeons, a leader in defending the practice of medicine for more than a decade. He has won victories before the United States Courts of Appeal to establish good precedent for physicians and patients. Mr. Schlafly has handled several lawsuits at this time to challenge the constitutionality of Obamacare. He is also an important, he has also an important lawsuit opposing maintenance of certification. In law school, he was editor of the Harvard Law Review, along with his classmate Barack Obama. There he is.
Thanks so much, John.
Thank you.
Yeah. Thanks to John and others for putting on this wonderful event. This is a large turnout. This is more than the number of people who signed the U.S. Constitution and other documents. I mean, yeah. In Ohio, what they were trying to do was to make maintenance of certification a condition for renewing your medical license. That's why Ohio is so important. And we stopped it. Led by Paul Kempen and the Association of American, we stopped it. So imagine that here in New Jersey. If that creeps into New Jersey and you go to renew your medical license and you get a little question at the end, have you complied with maintenance of certification? And you're like, whoa, where did this come from? And if you check no, then it's like, no, we're not going to renew your medical license. I mean, imagine that, you know. And these people who run these MOC organizations and the requirements are completely unaccountable to the public. There's no transparency. They're not elected. They're not, they don't answer any questions. They don't hold hearings. I mean, who gave these private groups so much power to determine whether the good men and women in this room are competent doctors or not? You know, we can understand a medical board having that kind of power. And by the way, John, we need to get you on the medical board. There's someone else, an imposter, who has your name on our medical board. We need to get you on the medical board. But, okay, so the medical board, there's some accountability there. Some. It should be more, but there is some. They hold public hearings. They're appointed by the governor. The legislature has some oversight. There are laws against them discriminating, et cetera. There's some, there should be more. There certainly should be more. But MOC, no accountability at all. Nothing. Zil. And nobody without any accountability should have that kind of power over doctors. And let me take a break for a second, just tell you a story about 25 years ago when I was on law review and we had the initiation and everything, got to meet the other new members of law review. There was one fellow who was not around that much. You know, he wasn't at those events they would have. We had a softball game to get people acclimated to the law review, and almost everybody showed up, and he wasn't there. And then there was a Christmas dance, and he wasn't there. And then it came time for elections after we'd been there 6 months to elect the officers for the next year and elect the president. And he shows up, and he's around all the time. And his name was Barack Obama. And there he is, and campaigning for president. This huge push from the liberals on the Law Review to elect him as president of the Law Review, even though he had not done any real scholarship. I mean, it's a scholarly journal. It's like these medical journals that you get that they're real scholars who work on that stuff, and it's a lot of hard work. That's what Law Review's like on the legal side. Generally, the people who run the Law Review are people who are there all the time. It's like running a newspaper. If you've ever worked for a newspaper, editors are there all the time, the people who run it. He was never there. I mean, he never wrote anything, but he shows up election time, and he was elected. And then the next day, there's a big article about his election in the New York Times. Like, whoa, you know, what's going on here? It's like somebody tipped him off, and this was supposed to be confidential, and what's going on? Well, there's, you know, a small group of people 25 years ago, a small group of people were grooming Barack Obama to become president one day. And this was something they wanted on his resume on his path to becoming president. And that is how the left operates, okay? They put strategy into this. You know, they put a lot of thought. And it's a small group of people. It's smaller than this room. And they sit around and they strategize. And they groom people. You know, on the Republican side, I mean, we're 2 years before the next election. Nobody has a clue who's going to be, you know, it's like, wow, I haven't even thought about that. Yeah, who do you think is good, you know? How about that guy with that bridge issue, you know? Politics, 90% of politics is below the surface. It's, you know, it's like an iceberg, right? 90% of an iceberg is below the surface. And that's what we're seeing on this MOC. Okay, there's all this stuff going on below the surface that there's no transparency or accountability, and that's what's pushing it. And we hear comments from time to time that, well, the people who do MOC, they believe this is better for medicine. They believe it's good for patients. I don't know if they believe that or not, to tell you the truth. They may be laughing about the whole thing. What they believe is it's a way to make money. That's what they believe. And they're making big money off this MOC, hundreds of millions of dollars. And if there's no resistance to it, if we don't stand up against it, they'll just keep doing more of it. You know, that's the way it is. When there's money to be made, if nobody stands up against it, particularly if it's harming people, they'll just keep doing more of it. And that's what the MOC people are doing. And they're just imposing more and more of these requirements because nobody's standing up against it. Nobody's stopping them. Nobody's resisting it. And it's the time, too, that it pulls doctors away from their practices. Each year, MOC gets more and more time intensive, demands more and more of a doctor's time. We're getting to the point where it demands hundreds of hours of a doctor's time to jump through all these hoops for MOC. When you add up the travel, the coursework, the chart review, et cetera, et cetera. Do you have hundreds of hours in a year to take time away from your patients, away from your family, et cetera, to jump through these hoops that have no proven connection with the quality of care? No, nobody in this room has that kind of time. As a patient, I don't want my doctor to be pulled away to spend time on this nonsense. I wish that my doctor had more time to spend with me. And patients recount this experience over and over. They go to a doctor, and it's like it's a few minutes, and you got a question, and one quick answer, and doctor's gone. Doctor's gone. Doctor has something else to do other than take care of your patients. Where is the doctor going to learn the most and improve his competency the most? It's going to be in patient care, not in Chicago taking some exam somewhere. And then, of course, the failure rates are going up, too. So you can go through hundreds of hours of work, and then you fail. And then what? You know, then you got to do it again. Then you got a black mark on your record. I mean, this is ridiculous. That the medical profession has allowed it to come this far is absurd. And we got to stop it. Here's what it is as a lawyer. I'm an attorney. 12 hours of continuing legal education a year. That's it. 12 hours. And it can be sitting in front of these computer screens. You know, listening to, somebody talk, give some seminar, 12 hours. That's it. In New Jersey, you have to do some of it in person, so there's some of that too. So 6 of that has to be in person. In New Jersey and New York, it doesn't even have to be in person. Just sit in front of a computer screen. We're professionals. Lawyers are professionals. Doctors, even more so, are professionals. You got your degree. You graduated. You don't have to get that degree renewed every year. You know, Barack Obama does not have to do maintenance of certification every year. When you're a professional, when you go through that process, it's a rigorous process. As we all know, the medical school, the residency, and of course everything you had to do to get into medical school, there's no reason for you to have to redo that now. You're a professional now. The control. MOC is also doing this to get control over you, to tell you what is proper and what's not proper. And there are valid debates about this. As a professional, the doctor decides what is proper for the patient, not some unaccountable organization sitting in Chicago. The doctor makes that decision. But with MOC, they're starting to impose strict guidelines. Where do these MOC organizations get their power? Now, who do I mean by the MOC organizations? There are like 30 of them. There are like 24 on the MD side. ABMS is the umbrella, and then you have all the specialty groups, ABIM, and then each specialty has its own certifying. And then you have some groups on the DO side, too. Where do they get their power? That's the question. Nobody in this room gave them that power. There was no law passed that gave them that power. Well, they sit in a small room, a small group of people, and they think of ways that they can grab that power. And the ways they grab that power is a variety of mechanisms. One is they creep into the hospital standards, and they get hospitals to impose requirements on the physicians on staff that if you're not recertified, you're not renewing your staff privileges here. That recertification is a condition for renewing your medical staff privileges. All right, I think that's a violation of antitrust law. And we, referring to the Association of American Physicians and Surgeons, which is the organization I'm general counsel of, and you all are welcome to join that organization. We have a number of members in this room. We sued the ABMS over that very issue. The way that they're having their MOC requirements creep into hospital renewal of medical staff privileges. That's restraint of trade. That's 2 private organizations agreeing to exclude somebody unless they jump through certain hoops. So that's our antitrust claim against the ABMS. It's pending in federal court in Trenton. We're waiting for a decision on it. One of the things the ABMS came back with in response to that is they said, well, we don't do business in New Jersey, so we should not be sued in New Jersey. Hello, you know, you don't do business here? I can go on their website and look up any physician in this room, and it will respond and say, this physician is recertified, implying it's a great physician, or this physician has not complied with recertification, implying it's a terrible physician. And it's promoting that about every doctor in this room here in New Jersey. It's in some of the New Jersey statutes. They got themselves written into some of the New Jersey statutes, and yet they claim they don't do business here. Well, in addition to the lawsuit, we should get our legislators to pass laws that say, hey, you know what? If you're not in this state, you shouldn't have any influence over this state. You know, if you're not going to be here and accountable here, then just get out. You know, don't bother us. Why are you throwing things into our state from Chicago, disrupting medical care, interfering with the physician-patient relationship from Chicago, and claim you're not even accountable in our courts of law? So our legislators could address that too. And we could pass laws prohibiting hospitals from keeping doctors off the staff if they're not recertified, or prohibiting insurance companies, which is another thing these MOC people are doing. They're getting insurance companies to require recertification to have doctors in network. Well, why don't we prohibit that? And say, no, insurance companies in this state, you're not allowed to limit who's in network to doctors who are recertified, because you know what? Recertification has no proven correlation with patient care. You know, if recertification was such a great idea, we should be able to look up malpractice suits, and it should say that there are more malpractice judgments against people who have not recertified than those who have. That's not the case. There's no difference in malpractice lawsuits. So without any evidence that this is doing any good, why are these organizations that claim not to even be doing business in New Jersey taking hundreds of hours of our doctors' time?